And then we blame racism.
Yeah.
I can tell you many people blaming racism in confidence. In Wigan, one of the consultants I had to dismiss was the Indian, 200 patient wrong diagnosis. And when he was being trained, he used the race card. So white people just let him. Nobody challenged him. I appointed him. I was not even told by two Indians there were concerns. And within a year, he diagnosed 200 patient wrong diagnosis. 200. I have met them. I cried with them. And he hasn't said sorry to them. Narcissistic personality. And when I met them, I'll tell you, even now I cry what he has done to these patients.
Welcome to the Global Indian Podcast, the official platform for people of Indian origin, because let's face it, we are everywhere. Welcome back to the show. Thank you for clicking on the link and finding out more about this remarkable conversation. Now, every week we plunge into the human experience of what's it like to be a person of Indian origin, take a second look at the countries we now call home, and importantly tackle the big questions we need to know more about. Well, I can't think of anything bigger at this moment in time than the global pandemic that is COVID. Now, the reality is, in the world in which we live, we place a great reliance on the integrity of those medical professionals going out there to help safeguard our lives. Now, if you're in the UK, we call that system the NHS. If you're elsewhere, it may be private, but the reality is the story still remains the same. On this show, we are very lucky to have a direct conversation with a very senior practitioner and doctor here in the UK who lifts the lid on something that you need to know more about. Not only can this podcast potentially save your life, but also importantly, it can help save the lives of those who are nearest and dearest to you. Now, the reality is, we would not be able to do these types of podcasts without the dear support of our sponsors. People like ShareMe.com, the app for all your beauty, fitness and wellness needs, and Nazran Roth, the platform to help global Indians remain global through a range of citizenship by investment programs as well as residency. If you'd like to find out more about the Global Indian series, it couldn't be easier. Simply go to our website, which is www.globalindianseries.com, where you can find the entire repertoire of conversations so far, as well as articles that will plunge you deeper into the human experience of our community and the remarkable lives in which we live around the world. I really do hope you enjoyed this session, and you need to do me a favor. We are heading up towards Christmas, which means we have done this podcast intentionally to act as a great mooring ground for you of something called common sense, which unfortunately, as you and I both know, isn't very common at this moment in time. So please heed the advice within this podcast. Practice the things that the doctor mentions, because again, it could save your life. And importantly, make sure you share this with your families and friends that you believe need to listen to this message. Because the reality is not just me and you, it's all of us that have to come together at this really important time in life to make sure we're all safe. Hope you enjoy the session. Please, please, please listen to every single word.
And just move. Get up 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 and just.
Why don't you introduce yourself to the audience so they know that they have a great reliance not on just your professional integrity, but your experience within the medical field?
Thank you very much, Rajan. First of all, it's a great pleasure and honor to be here. My name is Umesh Prabhu. I was a consultant pediatrician. I was originally trained in India. My values come from my grandma, Mahatma Gandhi, Nelson Mandela. And I had distinction in MBBS, distinction in DCH. But because of caste system, I was not selected through my post-graduation. And that is why I came to UK in 1982. And I was a consultant pediatrician. And then I became clinical director. And then I became medical director of Bury NHS Trust. Then I became National Patient Safety Agency board member for United Kingdom. Then I became the advisor for the whole country on poorly performing doctors. And I then went as a medical director to Wrightington, Wigan and Lee Foundation Trust in 2010. by 2016, we reduced harm by 90%. And it is not me who did it. It is the staff of Ridington, Wigan and Lee. And I owe a lot to the staff. I just challenged them and we transformed the trust from a culture of bullying to honest culture, speak up culture, and we put the patient safety at the heart of everything we do. That is my interest. I have given 300 lectures. I'm now writing quite a few books about patient safety, and I teach a lot about patient safety. Now,
So
to understand,
So I was going to say that you're an expert would be a fair thing to say. Just to paraphrase.
with my experience, you can say I got huge experience as well as expertise.
Wonderful. Okay. Because I know the subject that we're going to speak about is going to be quite challenging for the audience. And I think ultimately it's going to shift the mindset for a lot of people. I suppose before we get into the meat of the matter, why do you do what you do?
You have to understand why patient safety is important. One day we all will be patients. One day we are born with nothing. One day we are going to die with nothing. What you leave behind is your legacy. And that is what I want to do. I want people to understand the importance of patient safety because I've seen so many tragedies. I've seen doctors taking their own life. I've taken nurses taking their own life. 300 nurses have taken their own life in NHS. 46 doctors have taken their own life within a year of referral to GMC. 86 doctors have died. NHS is a great institution. I myself received amazing treatment. I'll tell you the statistics, but it is the small number where we have to focus. And that is why I'm so keen. And vegan transformation should tell you it is easy to transform if you know how to do it. And that is the reason why. And then I want to tell you international statistics for patient safety. And it is absolutely frightening. And that is the reason why, because I have met children. I have met families whose children have had brain damage. Most of them are preventable. And we have to look at as a human beings, the human tragedies. That is why I want to talk about it.
Absolutely. Well, before we kick off, some of the stats that you kindly provided. So that each year the NHS sees over 360 million visits. It's supported by 1.3 million staff. And in 36 hours, approximately 1 million patients are seen by nearly 40,000 GPs. It is huge. However, each year 20,000 patients die, 55,000 suffer for more than 6 months or are permanently disabled due to medical errors, and nearly 80 to 90% of these are preventable. So using that as a paraphrase to where we're kicking in, I suppose in a world now where we are looking at COVID, where there's a great reliance on the integrity of those medical professionals, but yet we're seeing a rise in, I suppose, mistrust, but also a rise in the bullying behaviors taking place in large institutions. Your voice potentially could almost be a thorn in the side for a huge program, or secondly, it could be the voice of reason that can actually shift, change, and positively influence the way that the health services are run, not just in the United Kingdom, but worldwide. So take this platform now, Dr. Umesh, tell us about the research that you've done and some of the horrific findings that you have come across.
First and foremost, let me tell you, vast majority doctors work very hard. I'm very proud of our noble and wonderful profession. Both GMC and BMA says doctors must be trustworthy. And I always agree with that. Doctors must always be trustworthy. Shakespeare was very clever. He says, honesty is the best legacy. He also says, hell is empty, all devils are here. So any organization, you have some good people, some bad people. Leader must always be very honest and very sincere with great integrity and courage. But you have to understand why doctors tell lies, because there is a blame culture. There is a bullying culture. And if you blame, for example, Baba Garba was a very good example. One junior doctor was blamed for the death of the child, and the institution was not held to account at all. And she suffered a lot. And GMC had 5,000 complaints following that doctor's manslaughter charge and imprisonment and erasure. So I've always said you should never blame one doctor, one nurse for any system's failure. We have to look at systems. We have to change the system. That is what we did in vegan. I told all the staff within a week of joining, we are here to protect patients. I'm here for you. Please contact me when it's too early, not when it's too difficult. And 70 staff came to see me. And it is their courage which gave me the confidence. And that is the reason why. This is an important topic because one day we will all be patient. And let me tell you some of the statistics for international data. This is not my statistics. This is from the WHO and WHO statistics. I'm just going to read it because I gave a lecture on it. 1 in 10 patients suffer an adverse event and 50% of them are preventable. Medical error, now one of the third leading cause of death in the United States. One of the third leading cause of death in the United States. 4 out of 10 patients had an adverse event in primary care or in outpatient. 4 in 10 patients. 1 out of every 7 Canadian dollar is spent on patients harmed by the medical error. In India, 15% of medical cost today is because of patients harmed by the doctors or the hospital. 15%. And it is paid by the patients. It is paid by the family in India. Here, at least, NHS is free at the point of delivery. But also, it is the brain damage. It is the severity. Imagine wrong kidney being removed. In Wales, they removed wrong kidney. And in Pool, they removed the wrong leg. So imagine if that is you or your father, your mother. That is why I'm so keen. And let me tell you some of the statistics for surgery. In USA, Medicaid saved $20 billion a year by investing in patient safety. Unsafe patient care costs a lot of money. 10 out of 100 patients suffer due to hospital-acquired infection. 10 out of 100 patients suffer due to infection they get in the hospital. 7 million patients develop surgical complications each year in the world, 7 million. And many of them are preventable. That is the reason why I want to get this message across. And let me give you 2 personal stories. When I had sepsis, I received a fantastic care. I was very sick. Ambulance came immediately. Ambulance treated me in my house. I went to hospital. I met 40 staff and I was treated brilliantly. But my wife, she had complication. My friend died recently. She was one of the most wonderful person, and she had unnecessary investigation by a consultant, and she suffered for 2 years. And look at the cost. At the end of 2 years, she suffered. She died last year. These are the human tragedies I have seen. That is why I want to talk about patient safety. That is why I want everyone to take interest in patient safety, including patients, doctors, nurses, managers, and everybody.
I think the thing is, for yourself, doctor, because you're in the profession, you know quite clearly what should be expected, and you know the rules, regulations, so on and so forth through that. For an average individual that hasn't got any medical background, they have this unrelenting reliance upon what the doctors mentioned. So when they're in the hospital, they expect everything that is done to them performed to the very best. They have no idea the questions they should be asking. They have no idea if what's being done is correct for them. So how do you arm those people, the general public, to know that they should be doing more?
It's a very good question. But what we did in vegan was you cannot expect a patient with dementia to know these things. You cannot expect a patient with the elderly patients who has got a lot of multiple problems to know all these things. So the responsibility lies with the profession. So in vegan, they had phone number, my secretary's phone number in every ward, in every department, so that anybody could contact. And that is how we transformed. It is wrong to expect a patient to know all these things. Yes, we must educate patient. Yes, we must educate relatives. In vegan, they had direct access. Complaints, I used to meet the family. Litigation, I used to meet the family. And everywhere there was a phone number. So they knew one number to contact. So that is what we got to do. It is the profession's responsibility. We should not expect patient and family, because you got nearly 60 million population in UK. How are you going to educate all the 40, 60 million? It is just impossible. And we also got 118 different languages. Many Black and ethnic minority, they don't speak English even today after staying in this country for many years. So what we did in Wigan was, anybody wanted to see me, they had phone number, they could contact me. My secretary returned the call, and that is how. I used to meet the complainant. I used to meet the litigation. I used to meet everyone, and even the staff had direct access to me, and 70 staff came to see me in confidence. So what you got to do is, you got to have openness, you got to have honesty, you got to have sincerity, you got to have integrity. And the first week alone, I told the staff, I'm not here to sack anybody, because to train a doctor, it takes many years. To train a nurse, it takes many years. Our aim is to learn lessons and to transform only bad people, which is less than 1%. Mahatma Gandhi was very clever. He says, don't lose faith in humanity. Humanity is an ocean. Few dirty drops do not make an ocean dirty. So vast majority staff come to do a good job. We have to put a robust system so that they are able to do a good job. And when they make mistake, they are able to speak about it openly, honestly, so that we can learn lessons.
So do you think the issue is then, if I were to read between the lines, that in the current NHS, people do not have the ability to speak openly and honestly about what they see?
Absolutely, absolutely. Look at what happened to this day. He raised concern about patient safety, and he was suspended, he was dismissed, he's still looking for justice. Sue Allinson, she had concern about patient safety in Blackpool. She was suspended, she was dismissed. I know many such stories. You can read on the Twitter, you can read on the social media. There is no openness, there is no honesty, and that is the problem. Many people don't speak up. And I can tell you a couple of cases. They're all public domain. Will Powell lost his son, Robbie, 32 years ago. And even now he's looking for justice. Even today he's looking for justice. And the doctors who made mistakes have not been held to account. Gareth Roberts, his sister died in Northern Ireland 18 years ago. And there have been so much inquiry, they are still looking for justice. I met the family, I cried with them. A child dies and we don't tell honesty, we don't tell the truth to the family for years. We got to look at our conscience. Are we human beings? Don't you have any humanity left in us? And that is what shocks me. And look at Ian Patterson in Birmingham, harmed many patients, nearly 600 women. They are still looking for justice. That is what shocks me. And Ian Patterson, many people knew about him, but nobody did anything because collusion. That is what is wrong. I told my friends who are doctors, politicians can play politics, but we doctors must never play politics. We must always be honest. We must always be sincere. And a child dies, we must tell the truth, but we must learn the lesson. And that is why. And my interest started after my own mistake. I went through hell. Somebody's child I was looking after, and that baby developed brain damage. 7 things went wrong. I didn't do anything wrong. But even then I could have saved that child. And that is the reason why I'm so keen to get this message across.
But you've also been, as much as you made a huge change to different organizations out there, you saw an uplift of 90% in some areas, or reductions to say of 90% in terms of the negative parts. You've also been, in want for a better word, persecuted for your actions. I know off air when we spoke, you said you went through a process that you thought enough was enough. You didn't want to continue this in the sense, and you actually thought about ending your own life. Like, what happened? What was the psychological impact that this journey's had on you?
I think 2 things. I made it safe because what it did was it was a nurse-led bullying culture, because nursing culture is bullying culture, and statistics is 30% of nurses said they have been bullied or seen bullying. 20% of junior doctors say they have been bullied or seen bullying. And that's the reason why bullying is a culture very common. To look after patient, it takes a lot of energy. It takes a lot of, because it's continuously, many sick patients come to hospital. NHS is a victim of its own success. Let us be very honest. NHS was an administered organization, and 1980s they bought managers. It's a managed organization. They reduced waiting time. They reduced waiting list. When I was medical director of Berry, I had 700 patients waiting for first appointment for more than a year. I had 400 patients waiting for surgery for more than 18 months. That was in 1980s. And then we brought it down, and a lot of patients start surviving. But the problem is, because of that, we are not able to cope with NHS now because demand is increasing, demand is outstretching. And before COVID, there was 100,000 posts were vacant. 100,000 posts. 10,000 doctors, medical posts were vacant. 40,000 nurses posts were vacant. That was before COVID. That is why I went to India to get doctors and nurses, because I want to help India, I want to help UK, and I want these doctors and nurses to go back so that they can serve India. Because being a doctor, being a nurse, being a leader is just serving the humanity.
Absolutely. So there's two questions there. I think the first one is about your personal voyage, because again, what I don't understand is that you've been fighting this incredible battle to say we need to shake things up, to make it better, more fair, but also equitable for those doctors and for those nurses, all the staff in the medical professions, that they feel valued, but importantly, that their voices are heard. But during that process, you have been victimized for that. Is that a correct assertion to make?
That is correct. Unfortunately, that is the culture, because today chief executives have no accountability. Board has no accountability. Speak up culture, speak up guardians. But that is within the organization. CQC inspects, but what actually happens deep inside the organization, nobody knows. NHS only tells the good things. What you've got to do is you've got to understand the bad things, because good things are important to celebrate. Bad things are important to change, because I always say it is my critique who teaches me a lot, not my friend. My friend praises me. That doesn't tell me what's wrong with me. In Vegan, I told my colleagues, please tell me what's wrong with me so that I can improve. In Vegan, all board members had a feedback, and that is how we changed the behavior. We had to remove some board members. They were bullies. And one of the finance directors used to go and sell to all the consultants, you guys are wasting money, you are useless. I told him, if you tell your children you are useless, they become useless, because that's a human nature. You have to work together, you have to respect each other, you have to value each other. That is what leadership is all about. Value-based leaders values everybody, appreciates everybody.
Also said then, in that mindset, coming on to the second question later then, in that mindset, why do you think people choose the medical field to become doctors? Is it because they have the empathy for what they do in most cases, or do you think some people have chosen the profession because of the financial ability that it provides them?
I think two things. It's a very difficult question to answer because you have to ask individuals. But what I would like to tell you the statistics. It is Pareto principle, 80-20 rule. As a medical director for 15 years, 80% of doctors never gave me any headache. 80%. Doctors are amazing people. They are very dedicated, very intelligent, very hardworking, very sincere. If you give them a very good facility. Because what they really like is seeing the patient getting better. What rewards me is when that child with meningitis goes home, shaking hand and giving me a hug. You cannot replace that with any money. That is why most people went into medicine. But 18% need help because they do private practice during NHS time. I was shocked how many consultants were doing private practice and leaving the junior doctors. And I saw complication with patients, so I had to be very strict with them. I said, you can do private practice, but not during NHS time. That is what, because I was shocked when I saw these things. Leaving the junior doctors do major surgery without supervision, patient had complication. I can tell you a lot of cases. And that is 18%. Then there is alcoholism, gambling. I had to deal with these doctors. I had to deal with doctors with mental health problems. I had to deal with doctors with autism, doctors with Asperger's syndrome, doctors with gambling. So these doctors need help. We must support them. I had doctors with stress due to workload. I have doctors who are rude, arrogant. I had to deal with all these doctors. Only one person, bad doctors, I had to dismiss. It is known as Pareto principle, 80-20 rule. That is what Mahatma Gandhi says. Don't lose faith in humanity. Humanity is an ocean. Few dirty drops do not make ocean dirty. There is also a good saying, fish rots from the head. It's a very good saying, fish rot from the head. In Hindi, There is a very good Yatha Raja Tatha Praja. As is the king, so is the kingdom. A king must be very honest. Only lion can lead lion's pride. Monkey as a king can only lead monkey kingdom. That is the reason why it is the culture, it is accountability which is missing in NHS today.
So coming on to the second question, we're in this incredibly strange, surreal situation of COVID. And we've seen the reports that the BAME community are the ones on the front lines, that there's a form of racism there because of all ethnic bias. What's your experience of this? And is the UK prepared enough to deal with the COVID issue as well as worldwide? Because
it's a very important question. I did a Zoom meeting on it. And let me tell you, UK, we were too late to lockdown. We were too ill prepared. We didn't have PPE in the beginning. We had, and there is a rumor, there was an inquest. I don't know which report. It was buried by the previous health secretary. I can't remember. I can tell you, find out the detail. Musa Qureshi has done some investigation, digging, and he has found the report. So we were not prepared and we were too late to lockdown. Why BAME people died? There are complex reasons behind it. It is not simple racism because nothing is straightforward in life. Even when the child dies because of medical error, there are a lot of systems issues. There are a lot of systems failure. And that is what I call a system error. And for BAME's community, you have to understand why. Number one is obesity in blacks is very high. Number two, diabetes in Asians is very high. Smoking in Bangladeshi men is very high. Number four, they work in small hospital with poor PPE. They are in the front line. Teaching hospital had very good PPE. If you look at the data, white people have died less because they work in teaching hospital. They work with good facilities. And whereas BAMEs, they work in small DGH. I had to arrange PPE for 5 of my friends in various district general hospital in the beginning. They didn't have any PPE. So we were not prepared very well. Then the poor PPE was one of the reasons why. But then our lifestyle, sedentary lifestyle, obesity, smoking, diabetes. If you look at the population, only 13% population is BAME, but people who have died, 38% BAME. And doctors, 90% of doctors who have died are black and ethnic minority. I have lost 36 of my friends in COVID. 36 of my friends in last 6 months have died because I was known nationally. So I have met many people. Now we are getting better. And because my son is a GP, I asked him recently, he said, Dad, we now got better PPE. We now got better prepared. But the problem is 30% staff are off sick or self-isolated. So imagine before COVID, we had 100,000 staff shortage and now 30% off sick or self-isolating. Look at the impact on staff who are existing because they have to work harder and harder. And harder you work, more bullying happens because they get short-tempered because you are stressed. And that is the reason why. What we need is happy staff, happy patient culture. Happiness is the secret of success. That is how Wigan was transformed.
No, I can see because there's this multiplier factor, isn't it? It's the externalities of that. You have stress staff. And if we've already got huge numbers, I think 20,000 people or 55,000 in terms of misdiagnosis in some cases, you can only see that being compounded at times of incredible stress as it is now. Doctor, how do you feel when in the UK, we were clapping once a week for the NHS, and yet you know inside that there's so much more issues at place? Is that a misinformed public to you? As well as well-intentioned it was, but...
Absolutely right. Clap is, I got great sense of humor. I said, clap is cheap. Anybody can clap. Anybody can appreciate. Anybody can say good things. But the most important is we must be honest with the public. We must honest with the public and tell them, look, these are the challenges we are facing. Let us work together. Help us and make NHS safe and best. Even now, I'm convinced we can. Let me tell you why. In Bangalore, there's a hospital, Narayana Health, Narayana Hridayalaya. They do 500 cataract operation a day. And they do 700 major cardiac operation a month in one hospital and 35 major cardiac operation in children every day using IT. And they do cardiac surgery for $1,000. And that is what anything can be transformed with digital transformation and with the artificial intelligence, with separation of emergency and elective, we can transform anything. But there has to be a will. Where there is a will, there is a way. And for that, the country has to unite and leader must bring everyone together.
So if you're talking about leadership, which leadership in particular? Are we talking about from the governmental side? Are we talking about within the different institutions? Is it both?
It is combination of both. And let me tell you something. I think it's Henry Ford who said, if anyone thinks government can solve all the problems, one must look at the plight of American Indians. It is culture. You cannot, if somebody doesn't want to change, you cannot force them to change. So it is not only the leadership from the health secretary, but leadership at the local level. That is very important. Trust level, CCG. What we have done is we have compartmentalized patients. Mental health separate, primary care separate, social care separate, secondary care separate. We have fragmented the service. What we need is a single streamlined service. And that is where you need a strong leadership, because housing plays a role, education plays a role, school plays a role, environment plays a role in the health. Number 3, habit plays a role. For example, obesity. Today, 30% of the population is obese. Smoking, alcoholism, all of them increases your cost on healthcare. So what we need is complete transformation of health and social care. And let me give you some statistics. 2% of the population, they are elderly. They have got multi-organ failure, kidney failure, liver failure, heart failure. When my 3 organs have failed, I don't want intensive care. Each day intensive care is 4,000 pounds. So what we got to do is we got to bring tender loving care. We got to bring dignity, death with dignity back. Instead of doing a lot of procedures, lot of operation. That is where I told that in vegan when I was medical director. Why do you want to do major operation when you are 98 with lot of comorbidity? And these patients get admitted to intensive care and you waste a lot of money. One elderly patient in vegan stayed in the hospital for 190 days. 190 days. Each day cost is 400 pounds in the hospital. She should have been transferred to community. In the same community, looking after the patient is 100 pounds a day, because you don't need very well trained staff. So
Because
what we need.
You're not advocating, you're not saying I understand what you mean, but to make it very clear, what you're saying is that we need to readdress what the medical industry is to the UK. But at the same token as well, as a general public, we need to play our part. We need to understand that we also are in control of our own fate. We are in control of our own health. And
Absolutely.
We subcontract common sense to professionals who are already going through their own human errors. As you rightly said before, 5 to 7 human mistakes per day is natural for people. But we also have to do the things that are right. Umesh, coming back to the patients themselves, at a time now where we have this unprecedented pandemic of COVID, what should they be doing to make sure that they safeguard themselves? And secondly, if they are going in for medical support for other reasons, how do they know if they're being treated fairly and appropriately? Because I can imagine there's a lot of ignorance out there. Because as well as it's good that your patients had your number or your team's number, I can imagine a lot of people didn't even realize they needed to give you a call up because they thought what happened was just it. They didn't realize that the failures or the injuries that they suffered afterwards was because of negligence.
First and foremost, let me answer the question, make it simple. COVID is a very dangerous condition. It is not an ordinary flu. And to tell you, I have lost 36 of my friends. And my friends in intensive care, they tell me how difficult it is to work in intensive care. Because your lung is like a solid and oxygen doesn't go in. It is that bad once your lungs are affected. It is safe for 80% of the people. That's the one message I want to give. But once are involved, it is like a solid, like sending oxygen through a rock. And many of them said, Umesh, it is impossible to ventilate. So my request to everybody is look after yourself. Follow the guidance and follow the strict guidance, hand wash, distance, everything. Hopefully vaccine will be effective. And once the vaccine effective by next year, hopefully we will control and regulate COVID in a lot way. So what patient must do, what public must do not go to hospital, do not go to see GP unnecessarily. But if you are unwell, please go and see GP. And I'll tell you why. My colleagues from Vegan have told me they are now seeing cancer too late. And that is what worries me. Heart attack, too late. Cancer, too late. Because once cancer spreads, it's impossible to treat. And in last 6 months, they are seeing cancer at late stage. And many of my friends are very, very upset because it affects doctors when the patient is very sick. If you come early, they can treat early. So my request is, still, if you need a doctor, please contact them. Teleconsultation has come. I have got some concerns about it because we have to make sure quality is good. I had very good treatment. I recently contacted my GP 3-4 times and everything was done very well. And that's because I'm a doctor, I know all of them. But I want even each and every elderly patient to get a good care. So my request is, please contact your doctor if you really need the doctor. But otherwise, follow simple advice, particularly high-risk people. For example, obesity, diabetes, hypertension, and BAME community. And all elderly people, they must not come in contact with people who have got COVID. So stay away unless it's absolutely necessary.
What's your biggest frustration with the community at large?
I think, to be honest with you, I think we are a divided nation. That is a fundamental problem. 49% think coming out of saying in Europe is good. 51% think coming out of Europe is good. That tells you how divided the community is. This is what I've been saying for a long time. Who divides the community? The community divides the community. And that is the reason why a leader brings everybody together. In Vegan, I brought everyone together: primary care, secondary care, tertiary care, and social care. And I had to thank the board because board gave me the support and consultants. Everybody came up. Everybody took the challenge. So success is when everybody works together. Henry Ford said, coming together is the beginning, working together is progress, winning together is success. What we now got to do is community has to come together. Community must come together. In Vegan, I brought patients, families, everyone together. And that is what we got to do. And my frustration is we are divided and we are dividing more and more.
Ironic, because you're saying come together and talking about division, whether it's the audience in South Africa or then the Caribbean or here in the UK or even North America. When we had issues such as Diwali, Eid, Vaisakhi, even Christmas coming up, for all the communities, one thing that we haven't done responsibly for in some cases is that we haven't kept the social distance. We've come together to celebrate, and then we wonder why then the infection rate goes up. And on the other side, we're celebrating not with just clean, good, healthy food, but we're intoxicating our bodies at a time when our immune systems need to be higher than ever before. Does that frustrate you?
You hit the nail on the head. What really frustrated me, yes, we have to celebrate, but we must also be careful. Diwali, my worry is Christmas. My worry was Black Lives Movement. It matters. Every life matters. But if you gather together and then fight, you are spreading the infection. So you are not achieving anything. Same thing. Diwali is very good, but the laddus we eat, the sweet we eat, we are stuffing ourselves, and that causes obesity. And that is the reason why obesity is a huge problem. Today, 30% of the people in the UK are obese, whereas in India, 5% people are obese. That is why mortality is very low in India, in spite of infection. America has suffered a lot. UK has suffered a lot. That is because of overcrowding. That is because of, we are not following strict advice. And number 3, obesity. And that is the reason why. What we got to focus on: healthy living, focus on exercise, prevention of health. What we got is now lifestyle diseases. And I can tell you, stress is a lifestyle disease. Mental health is a lifestyle disease. And let me give you statistics. One simple statistics. Nearly 1.8 million elderly people have no contact with human beings in this country today. 1.3 million elderly people have no contact with human beings because we have forgotten humanity. What they need is to mix with people. That is the reason why dementia patient, for example, if they don't see their relatives, their mental health decreases very rapidly. And that is the human contact is the most important for human beings. That is why children's education gets affected when they don't mix with other children. But what we got to focus on integration. As a community, we got to integrate. Doctors coming from India, overseas doctors are 6 times more risk to the patient because they have not been supported. I spend a lot of time now teaching them what to expect in NHS, how to get, how to be successful, how to integrate with people. Look, everything I teach them, prevention is always better than cure. One message with prevention is better than cure. One message about patient safety, prevention is better. One message about obesity, prevention is better. One message about mental health, prevention is better. Be proud of NHS. Be proud of this country. This is a great country. India didn't want me, I came to this country. This country made me a leader. NHS is a great institution. And that is what I want to tell you. Together, we got to make NHS safest and the best. Together, we got to build a great country. That is why Henry Ford's message is very important. Coming together is beginning, working together is progress, winning together is success. And let me also tell you Nelson Mandela's quote, 2 quotes which are very important because they had huge influence on my life. He said, winner is a dreamer who doesn't give up. My dream is to make NHS safest and the best. He also said, everything looks impossible until it is done. And Mahatma Gandhi said, be the change you want to see in the world. It's only when I changed, I was able to change Wigan. And Mahatma Gandhi also said, first they ignore you, then they ridicule you, then they fight you, then you win. I have to win not for my sake, for the sake of NHS, for all of our sake, for the sake of our country. This is our country. And John F. Kennedy said, don't ask what the country can do for me, ask what I can do for my country.
What do you class yourself as? What does Indianness mean to you now?
Right, very important question. I think Indianness is very important. Every culture has got good in it. Every culture has got bad in it. Let me tell you what is good in Indian culture, what's bad in Indian culture. My grandmother told me 5 things. I give it in all my lectures, her influence on me. I was apple of her eye because I was very naughty. I was like Krishna, nutcut. Because I was very bony also, very chubby. And I was very naughty. I like naughtiness. I like teasing people. I like pulling legs. And she told me a few things. She lost her husband when my mom was 7 years of age. She worked in 5 houses to look after 3 children. She didn't have any money. But then my uncle became very rich because he started his own business. He had 3 cars in 1960s. He was that rich in India because he started business. And she told me, always be honest, always be sincere. See good in others, do good to others. Focus only on you. One day you will be somebody. What others do is not your business. Only focus on you. And lastly, because she was Mahatma Gandhi's follower, she said, when you're doing something right, don't be afraid of anybody. Courage. So courage is important for a doctor. Courage is important for a leader. Without courage, you will not be successful in life because leaders take opportunity chances. But secondly, looking after your family. It's a fantastic human values. I regret not looking after my mom and dad because they made me who I am today. But fortunately, they got a very good brother there. I got a very good family. He looks after them. And that's the reason why I'm very happy. My sister is there. They look after. My mom recently died, but I was able to get all the treatment from here, sitting in home because I know all the doctors. And my dream was to make Wigan one of the best hospitals for elderly patients because of that. So that is good things about Indian values. What is wrong is we don't stand up for our right. Yes, sir, no, sir, 3 bags full, sir. Particularly South Indians. When I went to Wigan, 40% of doctors were black and ethnic minority, but only one was leadership position. They never challenged it. And that is the problem. We do not take leadership position. And then we blame racism. Yeah. I can tell you many people blaming racism in confidence. In Wigan, one of the consultants I had to dismiss was the Indian, 200 patient wrong diagnosis. And when he was being trained, he used the race card. So white people just let him. Nobody challenged him. I appointed him. I was not even told by 2 Indians there were concerns. And within a year, he diagnosed 200 patient wrong diagnosis. 200. I have met them. I cried with them. And he hasn't said sorry to them. narcissistic personality. And when I met them, I'll tell you, even now I cry what he has done to these patients. Because patient trust you. And you have misused the trust because he wanted to be international expert. He wanted to publish 19 papers and become famous. That is narcissism, which Donald Trump has. Most dangerous personality is narcissistic personality. And that is the reason why I've always said confidence is important, ego is wrong, arrogance is wrong, narcissism is most dangerous. It is 1% of the population.
Yeah.
Doctors got it. Lawyers got it, politicians got it, entrepreneurs got it. It is known as narcissistic, and then they become hubris, which means they think they are untouchable. And this guy was so arrogant, I called him, I said, look, I've seen many tragedy, I want to help you. He stood up, he said, you are a coconut, I'm going to sue you. He sent me 3 lawyers' letter for 3 months, then everything stopped.
I think that's the issue, because as a community, we use race or ethnicity when it suits us.
Correct.
And it's almost used as a bandage to say, I can't achieve something, so I'm going to use this to get myself through. But when we need to speak up, when we need to do things, when we need to stand the test of investigation for ourselves, being social custodians for this thing called Indianism or whatever term it may be, the silence is deafening. And that is what the issue is. And I suppose that's what the importance of you speaking on this platform is, because it wakes other people up to say, not only do I agree, but it fires me up so much that I'm prepared to speak up and make a difference. Because unless more people do that, it's like what we're talking about via WhatsApp. In order for evil to prosper, it takes good men to do nothing.
Absolutely, absolutely. Collusion is pretty bad. Collaboration is good. But collusion is pretty bad. Human beings collude and call it as collaboration. That is what. If you look at people who got OBE, MBE, it is a white privilege. And if you're in the same club, you get the same privilege. And I've told many of my friends, leadership is not privilege. No. Leadership is it's doing the right thing right for the humanity. Absolutely. A leader is a servant of the humanity. It's a servant leadership. I've given a lot of lectures. Yesterday, I gave lecture various type of leadership to Nigeria. It is a servant leadership. Leader and doctor is just a human servant of the human being. And leader care for the most vulnerable people because they suffer the most. Elderly people, we focused on elderly care a lot because 90% harm is in elderly patients. 90% of harm. For example, falls. We had patient falling, 46 patient serious injury when I went. We reduced it only 11 by the time I left. Pain management. When I went, it was only 56%, 98% by the time I left. And I'll tell you why it happened. I met a lady, very nice lady, white lady. She came to see me. She wanted to see me. And you cry when you listen. And she was 56. Her husband was 58. He died of cancer. She said she was holding my hand. She was just continuously crying. She said, Dr. Prabhu, my husband was dying. None of you could do anything. But why he had to die with the pain? He was not given painkiller for 2 weeks in the hospital. I was so shocked. I sent one email to all our staff. Imagine everybody said, Umesh, I'm doing this. So by the time I left, 98% got the painkillers. Because I just sent one email. I said, look, one day I'm going to die, but please don't let me die with pain.
Now you've heard it once, twice, 3 times, and tier 4 level certainty. Now the reality is no matter where you live in the world, we place a great reliance on the integrity of medical professionals. But we also realize that common sense isn't very common. Do your due diligence. If something doesn't feel right, or indeed you are going through something like the doctor mentioned, you are a medical professional and you feel that you are being bullied, or you're a patient and you feel that you have suffered from a misdiagnosis. In reality, it's over 50,000 people in the UK have been misdiagnosed and it's caused some form of permanent paralysis. 20,000 people have died from that. Now, if you or a loved one you feel have gone through any of the issues mentioned, go to our website, theglobalindianseries.com. You have a contact form there. Feel free to reach out and we'll signpost you to the very best of our ability. More so, we are heading towards the holiday periods and we're celebrating Christmas in a lot of the countries out there. And so communities and friends are getting together. Please do what the doctor mentioned. Please stay safe. I can't reiterate it enough. The reality is the doctor's seen over 36 of his close friends die of COVID. These were frontline workers. And also, importantly, rather than us in the UK or wherever we are, doing this wonderful clap for the NHS, well, why don't we listen to what the doctor's saying? Rather than just helplessly and aimlessly clapping out there for the ether to witness, let's do the greatest service we can for the medical fields and also the medical net that's available. Do common sense things. Keep your distance. Keep your mask on. If you need to self-isolate, self-isolate, because the reality is a clap is not going to bring people back to life and it's not going to prevent you from getting a disease or even potentially contracting a fatal illness. On that solemn note, I wish you a very safe, wonderful Christmas and holiday break. And I look forward to catching up with you for our last podcast of the year until we hit into 2021. Take care for now.